Hello, everyone. This is Eva Nolik-Smith with YogaUOnline, and I am very excited to be here today with Vicky Fox, a yoga teacher, yoga therapist, and cancer specialist in London, United Kingdom. We're particularly excited because Vicky is one of the longest active people specializing in yoga for cancer, and she runs an active teaching practice in London, both for private studios as well as cancer charities. And Vicky is the author of Yoga for Cancer, A to Z. And she is a specialist in how yoga can help us address the side effects of cancer, particularly those lingering in long-term cancer survivors. So Vicky, welcome. So happy to have you join us.
Oh, I'm very happy to be here, so thank you very much.
So first of all, tell me how you got interested in this work.
I think at the time I'd been teaching yoga for about 5 years. And my interest was always in anatomy, as we were discussing earlier. One of my teachers was Doug Keller, who I know is on YogaUOnline. And so always been working with Doug, very interested in how yoga can help with injuries, but also how not to get injuries through yoga. At the time I was looking just to expand out and do something that would be helpful. I wanted to do something that might help people with injuries. And at the time, a teacher came over from Boulder, Colorado, called Laura Kupperman, and she did a yoga for cancer survivors training in the UK. And it was, if you think a regular teacher training is 200 hours, hers was 150 hours. So it was very detailed, and she mentored me for a year. So when I first started teaching, I used to send her all my class plans, and she would, we would discuss why I had taught the class I'd taught and who came into the studio. And that was really the beginning of it. And I started working with some charities. And one of the charities I worked for was a wonderful charity. We do a lot of donation-based classes now because there are a lot of people can't afford to pay for the class, and they help pay for the people that can't afford to pay. And that way we create a community, which I think is probably the thing that I feel most proud about, is creating a community here of everyone supporting each other.
Right, right. And I think one of the statistics you pointed out to me when we were talking about this is how, cancer treatments have gotten better, and the detection devices are better. We discover more people earlier. So the outcome is that there is a lot more people living with the aftermath of cancer. And there's also projections for a lot more people getting cancer. I think the newest statistics is anyone born today will have a 1 in 2 life chance risk of developing cancer. But even for our generation, it's like a 40% risk. So it's really high. So what are some of the things you're seeing? I mean, obviously yoga cannot help cure cancer or necessarily prevent cancer, but what are some of the things you've seen where yoga can really help in this area?
Yeah, so I mean, yes, yoga's definitely not, this is not going to be curing cancer or anything like that. I mean, there are more and more statistics showing that we have less recurrence of cancer, or less risk of recurrence of cancer if we exercise. So we do have some stats on that now. But really what yoga is doing is dealing with some of the side effects. So if you start with the first side effect that everybody will experience, even if they don't have treatment, would be anxiety. You have a sort of loss of trust sometimes in your own body, because sometimes people aren't even aware they have cancer. They go for a routine scan, they find out they have cancer, and there's a distrust or a disbelief in their own body that it somehow let them down, that they weren't aware that something was happening. So anxiety, people go through numerous tests and scans, and they're poked and prodded, and they become a patient. And that's incredibly frightening, scary. So we know that yoga has, just by breathing, we know the effects of breathing, getting people back to breathing fully. I always say your breath is free of charge. You take it everywhere you go. It's such a wonderful tool to have. And so it's just teaching people some simple things that they can take into their daily lives. So maybe it's while they're waiting for a test result, maybe it's while they're actually having a scan or they're waiting for treatment, that they can use some of these breathing techniques. So the breath, I'd say, would be the most important thing, helping people with their posture, because obviously when you're scared and anxious, you have a more closed in posture. It's natural, right? You want to protect yourself. You're going through something really awful. And then there are various side effects that that I think yoga really does address. So one of them is lymphedema. So if our lymphatic system is compromised somehow, maybe by radiotherapy, which might damage lymph nodes or damage connective tissue. Maybe some people have had lymph nodes removed. They might have a lymph node removed to test to see if the cancer has spread into the lymph nodes. They may have had one removed. They may have had a full lymph node clearance in an area of the body. And this can mean that the lymphatic system doesn't work as well because it doesn't have, you're sort of almost hitting a dead end. There isn't any lymph nodes to filter through. And so the body can be a little bit compromised. It means fluid doesn't flow quite so freely, and people can get a buildup of fluid called lymphedema. And this is a chronic condition, so the lymphedema isn't going to go away. But we know with yoga, and I hear it all the time, so I'm lucky because I teach regular classes, I get the feedback that, people will say, wow, that was amazing. For, 24 hours, 48 hours afterwards, my arm felt lighter, or I was able to move my arm more. It just felt completely different. And then probably over a period of time, it sort of comes back because it's not going to go away, but you might be giving someone some temporary relief. And if you can imagine what it might be like to have an arm that's permanently swollen, how, even just flexing your elbow is challenging, various things are hard to do. So, yoga can help with the lymphatic system because the lymphatic system, unlike the blood, doesn't have a heart to pump it around. We know that the lymphatic system really responds to movement, change in pressure. We know that it responds also to breathing. Breathing, full diaphragmatic breathing helps move lymph fluid. Gravity, anytime an arm or a leg is higher than your heart, that's going to help move the lymphatic system. So that's just one sort of example of a side effect that can be helped. If you've had any surgery, if you've had radiotherapy can cause tightening or like a fibrosis of tissue in the body. Any scar tissue acts like a little bit of a gate, and it just stops the movement of fluid and also nerve impulses in the body. Another side effect is peripheral neuropathy. This is where the long nerves that run into the hands and the feet get damaged by treatment. And so people can end up on a mild form, maybe just a bit numbing and tingling at the fingers. Sometimes it can feel like burning, really challenging. People lose some of their dexterity skills, or if it's in their feet, they might actually trip because they can't really feel their feet. And so yoga just keeps the body moving. Maybe when you're not as connected to it. It keeps the muscles strong around those areas because some of these might be temporary. And nowadays, with a lot of the treatment nowadays, it's less likely that the peripheral neuropathy will last. But if you have had treatment a long time ago, you might have lasting peripheral neuropathy. So keeping people connected to the body, learning to sort of balance, having that proprioception of where they are in space, getting connected and acquainted back to their changing body, because if you've had surgery, you may have lost an area of the body, you might have lost some organs from inside the body, and yoga gives you that chance to get acquainted again. I mean, I honestly could talk for a really long time. I don't know how much. I mean, there's so much that I think yoga can really benefit, and we could sort of almost go through all the side effects and talk about, how yoga might be a temporary benefit or for some people a lasting benefit.
Yeah, because there's also the whole fatigue issue, right? Most the survivors struggling with fatigue.
Yeah, the fatigue is interesting because years ago the advice was to go home and rest. But we now know that actually the best thing we can do is stay moving, because, I mean, fatigue is happening because I mean, obviously, all the time within our body, you know, cells are programmed to divide, 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 and they're programmed to die. So your body's always cleaning up dead cells. Unfortunately, cancer cells divide, 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 and they're not programmed to die. So they're collecting. And so obviously, treatment that is attacking fast-growing cells in the body, it's going to kill off those cancer cells and other healthy cells as well. And all those cells die at one time, and your body's got to basically remove them, and that is exhausting. So that's what the fatigue comes from. But some of the fatigue is from periods of time when we're unable to move, we're in hospitals, we've got bed rest, and we lose muscle mass. So we know that what we want to do is try to keep as much of that muscle mass as we can, so that just your daily activities are less exhausting. Standing up in the shower is more manageable. Climbing up the stairs, maybe carrying some shopping, just trying to maintain muscle mass. You're probably, if you're going through treatment, you're probably not going to be building muscle mass, but you want to try and maintain as much as possible muscle mass. So I often give people exercises that they can just do at little points throughout the day, because the thought of maybe doing 60 minutes of exercise in one go could be too daunting. But, you know, maybe things like every time you go to sit down, stand up, and then sit down. So it's like doing Utkatasana or chair pose, you know, just for a moment before you sit down, and then eventually you sit down. So you can do that throughout the day, you know, balancing while you brush your teeth or while you're waiting for your kettle to boil, you know, more manageable bite-sized sort of little yoga snacks you can have throughout your day. And then, you know, when you feel ready that you can come back into a class, you can come back into a class. But having said that, all the classes are taught from a perspective that it is your class, not my class. I mean, they have my name on the schedule because it'd be very confusing to have lots of other people's names on the schedule, but it isn't my class. I'm just the guide, and that you as the student coming in, you're the best teacher. So if halfway through the class you feel fatigued and you decide you'd rather just rest, come into Shavasana or take your legs up the wall, but stay in the class, stay with the community, stay with the breath, don't feel you need to leave. So they're really very flexible classes. You know, they're really, you can do what you want as long as you're not doing anything dangerous.
Right. It sounds like the overarching theme of how you're serving this community of people is really teaching them, you know, better skills for self-regulating and managing their symptoms, managing their mood, managing fatigue, using the tools of yoga. But it sounds like it is essentially enhancing self-care tools.
Yeah, and I think sometimes also I want to move people from feeling like a patient. When you're a patient, everything's being done to you and at you, and you're told, go here, turn up for this, have this blood test, you know, turn up for this scan, and you know, sort of life becomes very routine like that. And I think yoga is empowering because it gives you back some control at maybe a time when you felt like life was out of your control. And also sometimes what I find is that people don't necessarily understand their lymphatic system. They don't understand that this is something you can actually help. Or when we have menopausal symptoms, because that's obviously if someone is on a medication which is reducing or blocking hormones in the body, they may go overnight into a sort of medical menopause. So the symptoms are quite severe. They don't understand that there are maybe some tools out there that you can use, you know, a cooling breath that you could explore to see, you know, does that work? Does that work for you as a unique person? So hopefully I'm trying to give people back some things that they can try themselves, and they say, oh, that's really interesting, I tried that, and I did that when I was really stressed the other day. I was waiting for an appointment and I got myself stressed, and I tried your cooling breath you teach, and it was amazing, it was really calming. So I think that's it. Just want to impart the bits I know or what I've learned about yoga to people that haven't learned lots about yoga but have an experience of cancer. And I learn from them because, you know, as a teacher, you really want to have a beginner's mind, a really open heart, and don't be afraid to ask questions because you can learn so much from the people you meet. And because the thing with cancer is that you may see two identical looking diagnoses on paper, they look pretty much the same, but they're not the same. They may not even be treated the same. They may have totally different oncologists, and also they're unique. They bring their own story, their own life experiences as well into the mix. So everybody's unique, and so you know, you have to just keep learning from everybody who comes into the room.
Yeah, it sounds like you're continuously very inspired by this work. You've been teaching yoga for cancer since 2013, so that's more than a decade, and you're still like obviously super psyched about it.
You know, you really meet the most amazing people though, because you meet people that are at a crossroads in their life as well. You know, life just hit them with something and people don't ever go back. You know, you never go back. We talk about going back to a new norm. You don't go back to normal because you just had a life-changing experience. So I meet people and I meet the most interesting people. And as a teacher, it's always lovely when you're teaching people who are interested in what you're saying. I mean, you know, you can't help that. You know, if you've got people that are like, oh, this is a bit boring, you know, oh, I wish she could do a fast vinyasa, that'd be much better, you know. But when you teach people that sort of want to know, okay, so you said alternate nostril breathing was calming, but why? Tell me, explain to me. I want to, you know, they really do want to know. And you talked about mudras the other day. Really? What are mudras all about? We'd really like to learn more. You know, so you work with a sort of, this is a section of the population that genuinely really want to understand how this might be able to help them and how they can use it in their real life to make, you know, life just more comfortable or better.
Yeah, yeah. And it also, from our previous discussions, it sounds like this is a little bit of a neglected community.
Well, I think, you know, I
World.
don't know in every healthcare system, but I certainly know from the people that I work with is that, you know, often you have treatment, maybe your treatment finishes and you've sort of been given a bit of an all clear, you're sent off, and you have side effects that you're living with that aren't really being addressed. And people don't, they feel sort of a gratitude, well, I'm alive. I should just be grateful that I'm alive. My treatment worked. Okay, yes, so I've got these few debilitating side effects that I'm really struggling with, but I should just get on and persevere and not complain. And sometimes there's not even someone for them to go back to talk to. And that might be different with the American system with, you know, obviously it's with private healthcare. Maybe that is different. Maybe it is easier to go back to an oncologist and say, look, I'm dealing with these side effects, you know, maybe they'll be able to help you. But I just know from, you know, we're very stretched, you know, there isn't time for doctors to support people. And also, you know, it may be that doctors don't necessarily know how someone could be supported because, you know, doctors in the UK are fantastic, but they spend 7 years of medical training. Some of that, this very small amount might be nutrition, a small amount might be menopause. And they don't necessarily know some of the integrative care. And there's a lot more integrative doctors now in the UK, and I know in the States, that are looking more at the holistic, the whole viewpoint. So yes, you might need chemotherapy and surgery and radiotherapy, but then after that, what do you do to sort of get back to a feeling of being whole again? And that might be nutrition, it might be meditation, yoga, you know, all other sort of modalities that we can use. So yes, it's definitely, I hear from people all the time, oh, I don't want to complain, you know, I don't even know who to complain to, I don't know what to do with these side effects. Well, I'll just put up with them.
Right, right. Yeah, doctors are trained to treat the disease, but not to help people feel good.
Yeah, and you know, you definitely want that. We want our oncologists to be really good at oncology. You want surgeons to be top notch on just, you know, doing surgeries. So we do want them to be specialists in their field. But yeah, it can leave people feeling very alone.
Yeah. And it also takes special training because, you know, even if you go to a personal trainer, they may not necessarily know how to work with someone who has lymphedema. I mean, there's like potential risks if you don't do it correctly. So it is an area where you need specialists, and there's not that many of them. Which brings us to you.
Yeah, I think it is important to have some understanding of what, and certainly the safety aspects of it. I think it's really important because I actually just had a student in my class on Monday at one of the cancer centers I worked at, and she has very limited range of movement in one arm from her treatment, and she's been nervous of moving it, so hasn't really been moving it very much. but went to a regular yoga class, and she just said, well, I couldn't do my downward dog. It was so disheartening. And I was thinking, if you can't get full range movement in your arm, and then you're expected to try and weight bear on it, I mean, it's just not going to be good. And then you can overload the lymphatic system, and someone could end up with lymphedema. I mean, there is no rhyme or reason why some people get lymphedema and some people don't. It's still, we're learning so much about it, but you certainly don't want to be putting your students at risk of doing something that could give them lymphedema.
Yeah, yeah. You said in your classes, everyone does their own practice. So how do you cue people? Because, one of the things everyone likes to do is they have this mental picture of what a pose should look like. And, they're trying to do it picture perfect. And even if you tell them to do their own pose, they may still be doing the image of the pose they have or whatever their neighbor is doing.
Yes, yeah. I mean, I do try to say, try to experience what it feels like rather than what you think it should look like. We'll all be making a different, all our poses are going to look different. Yeah, I mean, you can't help, it is sort of human nature that, it's how we create a sense of self, isn't it? By looking around and comparing and contrasting. So I'm sure there is some elements of that going on, but keep trying to remind people that it doesn't matter what someone else is doing, and forget how you might have viewed this picture. You might have seen it in a yoga magazine and think that's how it should look. You're doing your version of it. And life is constantly changing. This is a version today. It may be very different to the person that gets on the mat tomorrow, and just accepting that, life is constantly changing, and maybe trying to find that sort of true sense of self, that bit that isn't changing inside of you. But yeah, I think it's natural. I do the same sometimes. Have a look and try to work out how well I'm doing.
Yeah. But at least you set that stage for the whole class and whole space for them to be different.
Yeah, trying to say this should be a pain-free movement. You shouldn't be pushing into pain. If you experience pain, you want to back off, make the movement smaller. And I mean, that's all you can do, is impart that sort of ahimsa onto people for them to look after themselves and be non-harming to themselves.
Right.
And obviously scan the room for the occasional look on people's faces that are like, oh, this is really hard. Okay, maybe you want to slightly come out, or maybe you want to address your pose. And yeah.
What are some of the most inspiring experiences you had working with this group of people?
Oh, wow. I've had some really, well, I met the most amazing people and had the most interesting conversations. Um, I had one student, she had a thing called hand and foot syndrome. It's where the chemo can leak into the small vessels in the hand and the feet. So she had walked to class. She had a foot that was covered in these sort of blisters, these like little burns all over her feet, and her hands were the same. And she walked all the way to class to come and join the class. And she said, don't worry about me, do your normal standing poses, I'll just skip them. And I thought, no, we can't have that, because this is a class especially for anybody impacted by cancer. So we just did a lot of kind of kneeling poses and things like Paragasana, and so we just adapted the class. But that was pretty impressive, I think, pretty inspiring. Yeah, I meet people all the time that are inspiring. I don't know if I could even pick out, one particular thing, because there really are. I'm inspired by people and the community that is out there. And there are some real trailblazers as well. There are some fantastic people out there that are now campaigning for things like menopause and cancer things. And fighting for changes to be made at a government level, changing some of the because there's lots of inequalities in healthcare, and so there's lots of amazing, fantastic people out there that are doing some great work.
Trying to get more attention to the needs of the cancer survivor community.
Yes. Yeah.
Yeah, that's great. Yeah, I remember Dr. Lauren Fishman at one point remarked how, he had a fair number of cancer survivors, and at one point he remarked they lead lives of quiet desperation. I mean, there's a lot of people who were very courageously struggling with some serious things. And one of the wonderful things you're doing is you're providing a path and a forum where people can, first of all, live with it and see what other people are going through, but also get some tools to begin to self-regulate and do things that will at least make them feel better.
Yeah.
So you are teaching a course for us, which we're super excited about, on yoga for cancer. So tell us what you will be covering in the course.
Yeah, so it's quite a compact course. So we've got 3 different sessions. The first session is really just to understand, what is cancer, because I think it's really important to sort of just have a foundational understanding of what are we talking about when we talk about cancer, and what are the treatments that are out there, and what are the potential side effects. So the first sort of course is just the first series is just really looking at that, and then what we have in our yoga toolbox that we can use to try and support people impacted by cancer. And then the second part of the series is looking at specific. We're going to look at a few of the side effects. So we're looking at fatigue. Looking at osteoporosis, because obviously treatment for cancer attacks fast-growing cells in the body, of which obviously we have fast-growing cells in our bone marrow. And so this is something we definitely want to be mindful of, working with people that may be at risk of fracture. So we're looking at the side effects of osteoporosis, but also lymphedema. And then it finishes off with a class that is a sort of informative class. So I'm trying to explain things as we go through it as well, but it's a really nice class that's all about stimulating your lymphatic system. Because the other thing about the lymphatic system is it is part of your immune system. So, when we stimulate the lymphatic system, it helps to give the immune system a boost, which, as we know, when we're stressed, our immune system is lowered. When we're going through treatment for cancer, also our immune system is lowered. So it's quite nice to just give it a little bit of a boost.
And having a strong immune system is one of the best things you can do to diminish the risk of recurrence. So yeah, wonderful. All right, well, thank you so much, Vicky. We can't wait for the course. It sounds lovely, and thanks so much for joining us today. Really appreciate it. And so inspiring, all the wonderful work that you are doing. So kudos for you.
Well, and thank you to you for giving a platform to be able to better share this information so that more people can be supported. So thank you very much to you as well.
Thank you. And everyone listening in, be sure to check out Vicky's course and let us know if you're interested in a live stream with Vicky as well. You can always reach us at support@YogaUOnline.com. Namaste, everyone.
Thank you.